the founder and the light behind my vision. Please welcome to the stage the lovely Alice Crisci. Let her hear.
You're welcome.
Unbelievable. A little bit over a year ago, my vision debuted April 17th, 2008. That day was 4 days before my own double mastectomy, and 2 weeks after Lisa's. And here we are at the SLS Hotel, having an event with 260 people. Hearing a breast cancer diagnosis is definitely scary, but what was even scarier for me was hearing that I might be fertile after chemo. I've known my entire life that I was going to be a mom. And if somebody said there's a 2% chance that you could be sterile after chemo, I still would have done what I did, which was do 1 round of IVF so I could do an egg retrieval. I chose a donor sperm, froze 14 embryos and 11 eggs. My ovaries are overachievers. That planted the seed for this foundation, because truly, when you're faced with not only a breast cancer diagnosis, but a $12,000 to $20,000 medical bill for fertility preservation, your life kind of turns upside down. It's a worthwhile investment, and it's one that, very unfortunately, many breast cancer patients don't hear about the option. They don't even hear that chemo is a risk. They don't even consider the repercussions of if they have to go down the path of having their ovaries removed and they can't have children. Doctors don't talk to the patients about it. Breast cancer is the #1 reason that women seek fertility preservation. Cost is the #1 reason that they do not follow through on it. A quick story about a good friend of mine from back east. Her name is Patty. She was 34 years old, married. They hadn't had kids yet, and she was diagnosed the month before me. Patty was a married woman, and no one talked to her about the risk to her fertility. She went through surgery and then chemo and was hoping to do a round of IVF after chemo before she started a 5-year protocol of tamoxifen, a drug that when you're on it, you cannot get pregnant because it will 100% of the time cause birth defects. Her body didn't make the enzyme that could actually metabolize tamoxifen, so she had to go off of that medication and try a new one. Her cancer, aggressive, grew through chemo. It grew through trying tamoxifen. It grew through the other medication. She never got to do fertility preservation, and in a week and a half, she's having a full hysterectomy. We look at faces of breast cancer and we still think that this is a menopausal or postmenopausal disease. It's not. Yes, we will laugh tonight. We're laughing in the face and in spite of breast cancer for women of reproductive age, because it does threaten so much more than their mortality. It threatens their immortality. And your immortality is the opportunity to be a mother. It's the opportunity to have a child and to pass yourself on to the next generation. Is there anything else that's more human than wanting to be a biological parent? Couple things that I just want you to know walking away from this evening. The first thing is that my vision is about life. And there are a lot of organizations, and in fact there are millions and millions and hundreds of millions of dollars that go towards breast cancer research, that go towards finding a cure, and yet there are millions of women in this country living with breast cancer who have had psychosocial impact to their lives, who have had 5 miscarriages because chemo damages your ovarian DNA and it makes it difficult to carry. Some women are in complete menopause from chemo. I'm on an experimental program to suppress my ovaries for 2 years. I have an injection that prevents me from producing any female hormones. And ladies, you'd be surprised how little we actually need them. Everything still works. And I don't even have nipples yet. That's another shock with the breast cancer experience. When you have a double mastectomy, they often take your nipples. You get new ones. They're just not the same. You know, thinking about tonight, it was difficult to even choose what it is that I wanted you to know. I wanted you to walk away with knowledge so that you help further our cause of changing the social consciousness of this country, knowing that this country still leads the world. Bless you, Alexa. And breast cancer worldwide actually is a young woman's disease. The westernized nations have seen a very high incidence in breast cancer in women over the age of 45. But worldwide, this is the face that it affects. Lisa's is the face that it affects. The majority of my board members are breast cancer survivors. Shake their hand. They're amazing women. Tonight wouldn't have been possible without a lot of support from the board, from my family, from companies, and I just want to take a moment to express my gratitude towards them for everything that they contributed to make this happen. The SLS Hotel, is this a gorgeous venue or what? The Sage Group, they were so kind to underwrite this evening, and where are the people who are from Sage Group here? Yay! We love you. Crumb Bake Shop, Beverly Hills. You guys are about to have some cupcakes. The early birds get the cupcakes. Don't worry, people come in late. We're gonna, keep them to the side so they don't get to dip into our cupcakes. Chocolate covered strawberries by Berry Elegance. Thank you so much. Nuvo, your bubbles this evening are compliments of Nuvo. Thank you. Who am I missing?
If you forgot anybody, I'll tell them.
Okay, good, thank you. So, before you go, I want you to take note of this V, or before I go, because you're staying here. This V, and yes, it's a tattoo, one of the many things I didn't think I'd ever do until I got breast cancer. The V stands for Vision and Victory. You're here tonight contributing to an organization that is directly ministering to breast cancer patients every day. We are the only website that educates anyone on breast cancer and fertility. When you see this V, what I'd like to know is that it reminds you to live the life that you imagined. That's all we're up to. We're up to making sure that every woman who's touched by breast cancer has the opportunity to live the life she imagined. My life is so good now, I couldn't have even imagined it. So thank you for being here.